Portland mum Kerry Pearce has survived 2 strokes and 2 heart attacks, but she's worried what might kill her is a mole on her arm. Her surgery to have the melanoma removed next week has been cancelled because of the Code Brown emergency.
We thought cancelled? How can it be cancelled? It's cancer, not a freckle. Doesn't Kerry's life matter? And Kerry feels like her life isn't worth saving.
Non-essential services have been postponed and nurses' leave cancelled after the government called the Code Brown to try to keep the crumbling health system afloat. But with more than 1,200 hospital beds taken up by COVID patients, it's people like Yeha Abud who are suffering in severe pain.
You have to check up. Maybe I have cancer and kidney. Maybe, I don't know.
The keen fisherman has cysts on his kidneys and has been told he can't get in to see a specialist unless he has COVID or has already been diagnosed with cancer.
It's incredibly difficult decisions to make. They're there for the best of reasons. I just say to those patients, if there was another way, then of course we would do that.
But another way forward has been found for women undergoing IVF. The state government's reversed its decision to pause IVF procedures after an emotional campaign from women like Melanie trying to conceive.
So I get to start my cycle, and when we take that first injection tonight is when it will really start to sink in. Yeah.
I apologise for any distress, for any concern. It's never easy. It's never easy in such challenging times.
Announcements on when other day procedures can resume are expected soon.
They're looking at bringing life into the world, but they're not here to save lives that are already here.
In another attempt to save lives, the state government has ordered an extra 166 million rapid antigen tests on top of the 44 million already on the way. But it isn't cheap.
But it'll be hundreds of millions of dollars and it'll be brought to book and reconciled in the usual way.
But there's no timeline for when those extra rats will arrive. The Premier says the new order isn't needed right now and will eventually be added to the state's stockpile.
We needed rapid tests weeks ago.
More than 2 million tests have already been handed out to health workers and vulnerable Victorians. Bridget Rollison, ABC News, Melbourne.